Hi, my name is Diana, and today we're going to be talking about diaphragms as a form of birth control. So, the diaphragm is a form of birth control that is a shallow cup shaped like a little saucer and is made of very soft silicone. It helps to prevent pregnancy by working as a barrier. It covers your cervix and stops the sperm from joining the egg. However, in order for the diaphragm to be most effective, you must add spermicide. Spermicide is a cream or a gel that actually kills the sperm and must be added to the diaphragm before it's inserted into the vagina. For the most part, using a diaphragm is fairly easy once you get the hang of it. It will take practice, but your nurse or doctor will give you instructions on exactly how to use it. To start off, you must make sure that you wash your hands with soap and water. Next, you put spermicide into the diaphragm. After you put the spermicide, you must get into a comfortable position, similar to the position you use to insert a tampon. You can either stand with one foot on a chair, sit on the edge of a chair, lie down, or even squat. You also have to separate the lips of your vulva with one hand. You can use the other hand to pinch the rim of the diaphragm together to fold it in half, making it easier to insert. Now you can push the diaphragm as far up and back into the vagina with the dome pointing down. To assure it's secure, the diaphragm must be behind your pubic bone and you cover make sure your cervix is covered. Taking out the diaphragm is a lot easier than putting it in. All you have to do is relax, insert your fingers into your vagina, and gently pull the diaphragm down and out. Once it is out, you take care of your diaphragm by washing it with soap and warm water after every use. You must also make sure to let it air dry and be careful to not use any kind of powders. Store your diaphragm in a clean place away from external heat and direct sunlight. Also, make sure that you are always checking for holes, cracks, wrinkles, and test for leaks. Now we are going to go over some statistics when it comes to the effectiveness of a diaphragm. When used perfectly, the diaphragm is 94% effective. However, we are only humans and can't always do things perfectly. So in real life, diaphragms are only 84% effective. This means that out of 100 people, 13 will get pregnant every year when using a diaphragm. If you want to get If you want to increase the effectiveness of the diaphragm, you must use it every time you have sex. This includes using the spermicide with your diaphragm. You must also put your diaphragm in before you decide to have sex and make sure that it covers your cervix. To increase the effectiveness even more, you can use a secondary method of contraceptive, like withdrawal method or condoms. Purchasing a diaphragm can cost you anywhere between 0 to $250. These prices include the cost of the exam, fitting process, the diaphragm itself. You will also need to get the spermicide, which is an extra $5 to $15 a kit. There is also a good chance that you can get the diaphragm for free if you have health insurance. If you don't have health insurance, don't worry. You definitely have other options depending on your income. You may qualify for Medicaid, which will help you afford birth control. Planned Parenthood is another program that may give you access to the diaphragm, whether or not you have health insurance. If you do decide that the diaphragm is your desired choice of birth control, you can purchase it at a pharmacy, drugstore, or health center after you get a prescription from a doctor. The reason you need a prescription from a doctor is because you must first get a diaphragm fitted before officially using it. Since you need to use spermicide along with your diaphragm, you can purchase it at any drugstore without prescription. For the most part, sharing is caring, but when it comes to a diaphragm, it's not one size fits all. There are so many advantages to using diaphragms as a form of birth control. They are so small that you can fit them anywhere you need to go. They are also a non-hormonal birth control, which makes them effective as soon as you start using them, but also makes it easy to stop using them if you decide to. Diaphragms don't interrupt sex due to the fact that you can insert it 2 hours before having sex because the spermicide works for that long. And you can also leave it in for as long as 6 hours after having sex. Most people and their partners also don't feel it that much when having sex. Lastly, diaphragms last as long a long time compared to other barrier methods like condoms. Like all contraceptives, diaphragms have some disadvantages to them. In order for a diaphragm to work properly, you must use it every time you have vaginal sex. You must also ensure that you have properly inserted it. Inserting the diaphragm has been challenging for many people, which is why it might not be as effective as other methods. Another disadvantage has to do with the spermicide. Using it can cause irritation of your vagina. It can also increase the risk of getting STI, specifically because it does not protect you from getting STIs. Lastly, it is not recommended to use a one size fits all diaphragm. So that means you will have to get it fitted before you insert one. If your body ever changes, you might have to get your diaphragm refitted, which can also be a hassle. In conclusion, there are so many types of contraceptives out there, you have to make sure that when choosing one, it is the right one for you. That's why we made the diaphragm available for all women all over the world. Now it's your turn to decide. Is the diaphragm the right choice for you?